because one of the first questions is about polycystic ovary syndrome, and someone has asked whether you could shed some light on the relationship between that condition and low-carb, high-fat diet and how it could potentially help.
Well, first thing I want to say is that it works. Dr. Paul Mason did show some of those insulin graphs earlier today, and I certainly do a lot of those as well. Almost universally, there are high insulin levels in polycystic ovarian syndrome, and there are other things as well. Androgenization, which, higher than normal levels of testosterone, infertility, loss of the menstrual cycle, etc. A lot of that being driven by insulin resistance. And so when you drop the carbohydrates, the insulin goes down, and a lot of those metabolic derangements start to reverse. And then you see, which is wonderful, the woman's menstrual cycle starting to come back regularly, the acne disappearing, even some of the sort of unpleasant things like the increased body hair going. I don't know if anyone else wants to comment.
We tend to see quite a lot of PCOS presenting to the clinic, and as Sean just said, there's three main features seen in PCOS. So it's called the Rotterdam criteria. So there's hirsutism, which is basically excess facial hair, amongst other things. Altered menstrual cycles, which leads to the subfertility or the infertility, which we often see. They're probably two of the main ones which we concern ourselves with, and both of those are causally related to the high levels of insulin. So I'd have to fully agree that we often see improvements in fertility. We see normalisation of the menstrual cycle. We see improvements in the facial hair in females, and obviously a reduction in body weight in females with PCOS. It is interesting to think about. This is almost something, it's so common. It's probably, almost 5% or more of females will have a degree of PCOS, and there's some thought that it might be evolutionarily selected for in times of famine, because it's those who have stored more adipose tissue which are more likely to survive. So it's interesting if we sort of reflect on that side of it, but certainly a fasting type diet, a ketogenic type diet gets excellent results.
The interesting thing is I actually had a patient come to see me who injured her knee. She needed an ACL reconstruction, and I did the surgery, everything went beautifully, she got back to sport, but she had been a fanatic exerciser all of her life. It was the only way that she could control her weight. Her sister then injured her knee and came to see me. And she wasn't an exerciser, but her knee was giving way, and that was the reason I needed to do surgery on her. But when she was actually under anaesthetic and then we were talking to her, I noticed a lot of these features about PCOS, and I said to her, look, you really need to consider seeing somebody about this, because with her sister exercising like crazy to stay not thin, but even probably just a little bit plump, she was definitely on the bigger side. And she went to see Paul, because I don't treat these patients myself, I just send them along to Paul to treat. And she ended up having PCOS, and she's had an incredible result from weight loss, energy, and is now super happy with her life, where she was miserable and unhappy, unable to lose weight beforehand. So it's definitely a success story when these patients get treated.
Just going